my name is Jaden, and this is Living with CCI, which stands for Craniocervical Instability. So I've been making these videos. I'm trying to do one per day, and to kind of keep the momentum going until I get to the end of my story and what I have to share. I was diagnosed with craniocervical instability at the end of 2022. It's now February of 2023. But I started noticing symptoms, or what I now know to be symptoms, about 10 years ago in 2013. And in my first video, I talked about what those symptoms were and the things I was doing to try and address them. A lot of conservative care with some massage, chiropractic care, acupuncture, Feldenkrais, stretching, personal training for trying to strengthen specific areas, and some specialized massage that helped me with my neck while I was running. So that was kind of like the first phase of dealing with it. I found that the symptoms were quite manageable in the first couple of years. I guess probably like the first 3 or 4 years, so more than a couple. But yeah, it came on very gradually, and it progressed fairly gradually. And so in my videos 2 and 3, I talked about the path that led me through regenerative medicine. So I did a lot of discussion of the 2 PICL procedures that I had. PICL is probably one of the more advanced treatments of CCI that's available in Denver, Colorado. It's a stem cell procedure, but really it's a whole bunch of things. It's injections in the back of your neck. It's injections in the craniocervical ligaments through your mouth with regenerative products such as stem cells and PRP. And so it's a sort of comprehensive way to try and treat people with CCI that's very targeted towards the problem area, which with CCI, it's essentially the ligaments that hold together the C1 and 2 vertebrae to the head. So craniocervical instability, the cranium is the head, and cervical spine is the neck. So as you can, when you put those two together, it's basically the junction of the head and the neck. And what holds that all together are, a bunch of ligaments. And people with CCI have too much laxity, or they have damage to those ligaments. Ligaments keep joints from moving further than they're supposed to move. And therefore, when they're damaged, joints will start to move out of, beyond their normal range. And that leads to muscles having to take up the slack, which is hard on the muscles. So you get initial symptoms for a lot of people. You get a lot of muscle strain, and it hurts to hold your head up. I used to use that phrase when I first started seeing doctors, even that I had sort of a heavy head. It was hard to hold my head up, and I also had a lot of headaches. And headaches can come from a lot of things, so that's a tricky symptom to have with CCI. In my case, I believe the headaches are triggered by a nerve problem. The nerve that runs up C2, or that runs from the back of C2, is called the occipital nerve. That is responsible for giving you the sensation throughout the back of your scalp. And so when that nerve is irritated or injured or whatever, it will cause pain in the back of your head. And when you have pain in the back of your head, it triggers headaches. At least that's my understanding of it. So that's kind of, I think, where my headache comes from. But I also have the muscle pain. I also have a heck of a lot of joint pain and crepitus, which crepitus is the sounds you hear when a joint is cracking or popping, which in most cases is pretty harmless. Like people crack their knuckles and things, and you hear the little sounds. And it's just sort of a joint, resetting itself, releases a little bit of gas, I think, that may have been in the joint, and that's why you hear the sound. And but in the case of my neck, it's I think it's the sign of a beat up facet joint or set of facet joints in the back of the cervical vertebrae. Facet joints are the joints in the back of each vertebrae of the spine. You have facets in the back, and then you have discs in the front of the spine. The discs give you the kind of allow the spine to absorb shocks. So if you're out there running or you jump and you land on something, the discs will actually absorb quite a bit of the force. And then the spine also is shaped kind of like an S, and so the shape of the spine is also designed to work like a spring a little bit, so that the force is not just entirely taken by the vertebral column, but it's also sort of absorbed by the fact that the spine is curved, and it can work a little bit like a spring would in absorbing shocks. So so I'm just giving a little bit more for people that are maybe joined late or are confused by some of the stuff I'm talking about in other videos or in this video about the background of the spine, at least what my rudimentary understanding of it. I'm not a medical person at all. I've had to learn all this on my own, which, became very necessary because I realized that, and then this is, I guess we're all, just one of the takeaways from everything I've been through is you have to educate yourself. The medical system, at least in the US, it's a market-based system. There's a lot of people selling treatment, including, regular doctors. They're all in business, and you have to be educated about what you're, being offered and whether it makes sense, and, whether you agree with a particular diagnosis or how your symptoms align with what they're telling you that you're going to get treated for. It's really up to the patient to know, understand and know this stuff. I mean, I suppose you can rely on your doctor, but they're busy. I mean, like in their defense, like they see many patients, and they don't know everything. I mean, there's no doctor in the world that knows everything. So you are kind of the expert on you. I mean, you know your symptoms, you know your body. So I would encourage anyone going through a chronic health problem or any health problem to get as educated as you can on your situation, and without getting too crazy, like, and I've had to be careful at times, like to make sure I'm not getting too deep in, paranoia or anything like that about conditions that I might have, or so I always usually I want to understand the theory of, okay, what is the spine, and what's the purpose of all these structures, and what do they look like, and some of that is just trying to interpret your own imagery as well. So if you get a MRI CD, I'm tempted to like pop it in the computer, and then you bring up these slices of your body, and it's just like, what the heck am I looking at, right? So it's, not everyone is going to be interested at that level, because it is, you have to really, even myself, like I can't really follow MRIs as well as other people can, but I do look at them, and I try to compare with other things I see online, and I've watched some YouTube videos of, interpretations of C-spine x-rays, and just anything you can do. Like, generally if you have chronic pain, you've got the time because you're home and you're not out living your life. You're kind of home dealing with your pain. So take the time to educate yourself, understand, your symptoms, what they might mean, and, how the structures that are affected in your body work, so that when the doctor's giving you a proposal or trying to, sell you on something, you kind of have an understanding of, what, how that would fit into what you're going through. So, okay, so I think what I want to do with this video, so I talked a lot in the last two about regenerative medicine, and I ended with my sort of closing the door on regenerative medicine. I failed both PICLs, unfortunately, but I don't think the PICL is a bad thing, or that I was, in any way taken advantage of or anything. I mean, I think it's a reasonable option for people with CCI because we just don't have many options, and it does appear to help people. But the research is still ongoing. I mean, it's not a very big population of people, so it's just hard to know how long it's going to take to get reliable treatment that we can know the statistics on and all of that. So anyway, so regenerative medicine kind of I talked for 2 hours about, and I don't want to get into that anymore. But what I'm going to do actually with this video is to go kind of a little out of sequence. So I'm actually going to go back in time to before I had PICLs, before I did too much regenerative medicine. I did a little bit in the earlier initial phase of my treatment. But I just want to talk about some of the other things that I tried that were, cheaper, more local, and most of them were treating symptoms because I didn't know I had CCI. So so this video might be a little hard to follow just because I'm kind of wandering back in time and compared to the sequence I've followed so far. I'm going back to sort of a period where I knew that I had a serious problem with my neck. I had stopped running, and it was getting harder to drive as well. I mentioned in my last video that I basically gave up driving, although I can still drive. I mean, if I need to drive, I will do it, but I don't drive. I gave up my car like 3 years ago and just don't really miss it, to be honest. So it was a personal decision. It was a lifestyle decision that I made. I don't feel like, I guess if I really, really had to drive, I would focus more on adapting that to make it more comfortable for me. But anyways, so what I want to talk about is just sort of that phase between, I guess it's more on like initial treatment, but not regenerative medicine. So that's kind of why things got a little out of order. Okay, so I'd had an MRI in 2018, which was the very first MRI in my life, and it showed that I had a straight neck, which is generally a postural thing. Just years of bad posture, and when I was younger, and ended up kind of losing the curve. Quite a bit of the curve in my neck. There's a little bit there, but at least it wasn't a reverse curve. There are people that have the curve is actually reversed. In my case, I just have loss of curve. And I also had a disc bulge at C5-6, which again is, when you first see it, it's like, oh, it's very concerning, but it's actually a really, really common finding in an MRI of somebody, in their 30s or older. So once that was explained to me, and that it was, I pretty much determined that it was asymptomatic. It wasn't causing my symptoms. A C5-6 disc or nerve issue would cause problems in the arms and motor strength of holding things with your hands, things like that. I didn't have any of those symptoms. All of my symptoms were upper cervical, so from the top of the neck up the head, in the back of the head. Those are all upper cervical symptoms. I also had a little bit of, I haven't mentioned this before, but I had a weird vision thing going on that did kind of resolve, but vision symptoms are definitely upper cervical as well. So that's why, it's blurry vision or changing vision is a symptom of CCI as well. I did have some problems with glasses. I guess I can talk about that. I mean, this video is going to be all over the place, but whatever. I'll do my best, okay? So, this was early, actually, in my symptom experience. Was I had some problems with my glasses. And, well, first of all, I didn't actually wear glasses until 2013, which is when all my CCI stuff started. So, I wonder if there's a coincidence. I've thought about it. I don't really think there was, but I had glasses as a kid from third grade. So, I'd always worn glasses. And by the time I was in my 20s, I'd had a very strong prescription. I was very nearsighted. which means it's hard to see things far away. So I had thick glasses. I believe I was a -9 and a -11. For those of you that know the prescription strengths of glasses, that's pretty heavy duty. And I decided at age 25 to get LASIK. So I had LASIK in my 20s, which was great. Like, it basically worked fairly well. I didn't have perfect vision, but I was fine to live my life without glasses. I drove without glasses, all of that. But I still had some issues if I was in a movie theater, like sitting in the back, like with my LASIK, it's like it still wasn't quite as good as I guess it could have been. And I did get it checked, and they're like, we could give you glasses if you want, but it's up to you. And I just, yeah. So I didn't get glasses at that point. Like, I was happy with the LASIK until I was 33, and I had gotten new health insurance. So so I got new health insurance, and it included a vision exam. Like, it was, normally I wasn't buying vision insurance, but this one, it was all one package, and there was like, oh, you can get a vision exam. And I thought, like, okay, well, that's a responsible thing to do. Like, I'll go get my eyes checked. And it was funny because I sort of drove there, went in, and was expecting to, them to tell me, you're 20/25 vision, which is what I had coming out of LASIK. So it wasn't 20/20. It was slightly worse, but only 1 degree worse than 20/20 vision. So I went in, and he checked my eyes, and then he just kind of looked at me, and he's like, "Have you been having any trouble seeing things?" And I'm like, "No, I think, like, I have to squint a little bit, like, to see signs in the road sometimes, and like if it's dark or the weather." And like, he's like, "Yeah, because based on these numbers, like," he's like, "you shouldn't even be driving." So as it turned out, I just got very used to accommodating for my declining vision for probably quite a while. And by the time I had that eye exam, I had no excuse really anymore. I had to get glasses again, because my vision had slowly degraded so much that I really needed to have glasses. So I got glasses, but that wasn't the end of it, because I was given this prescription, and I wore it because, like, okay, it's like I have to do this. And then I would get headaches, but they weren't the kind of headaches I have from CCI, which is why I think it's probably not related to CCI. But I was getting these headaches, and they were kind of more in the front, and they were really bad headaches. And I had trouble with the glasses. Like, if I take the glasses off, the headaches would kind of resolve, and put the glasses on, and I'd, headache would build up, and I wasn't sure. Like, so I kept going back to the doctor, and after a while, like, he got really fed up with me, as so many doctors have now in my life, because I'm a tough customer. But yeah, he was like, "Oh, you again? What's going on?" And so we tried like a few different prescriptions in a period of like a couple of months. Like, he kept just changing it, and I'm like, what's going on? Like, why are you changing my, like, a prescription is supposed to be, done properly. You order the glasses, and then you don't do any. I mean, glasses are supposed to last you at least a year or two, right? Like, you're not supposed to be changing them like every month. But he kept changing the prescription, and I'm like, okay, what's going on here? Like, what's the deal? And he said to me, he's like, I don't know. Like, your prescription literally changes every time I went in, and it was this great mystery. So I don't know. I mean, that's why, like, I do wonder, like, if there was some relationship to getting CCI. I don't know. Just even talking about it now makes me like, oh yeah, I guess I should have thought harder about this. But anyway, so I had this sort of wavering prescription that was giving me headaches, but they were headaches in the front of my head, which were different than the headaches I have now and I've had for years. But so what ultimately happened, to sort of wrap up that portion about the whole vision problem is I went to see some specialists. They were worried that I might have had my cornea might have actually been damaged by the LASIK, so that was checked, that was looked into. And then the last specialist I saw, he said to me, he's like, "Do you spend a lot of time on a computer?" And I said, "Yeah, I mean, I spend all friggin' day in front of a computer." And he's like, "Have you ever been given, computer glasses?" And I was like, "No, nobody's ever given me computer glasses. Like, I'm not 60 or what, like, whatever. I was young at the time." So he said, like, "Yeah, you need to go back to your optometrist and ask him to get you intermediate distance, computer glasses." He's like, "You don't need reading glasses," but he's like, what he thought was going on with my eyes was that I was, the iris or whatever, the muscle that controls the focusing was spasming because I kept going in from, one distance to then a long distance. And I don't know, he had this theory that because I was on a computer so much, I was causing all this muscle spasm and, the muscles controlling the eyes. So I went back to the optometrist and I got the computer glasses in addition to regular glasses, and then everything seemed to resolve. So that's kind of why I don't think any of that is linked to CCI. I think it was just something with my eyes, and once they figured out that I needed 2 pairs of glasses instead of 1 pair of glasses, then basically got better. So okay, so that was a huge tangent. So yeah, I did have some weird vision things going on, but I didn't have the blurry vision as far as like extremely blurry vision. It was just like out of focus vision. And I didn't have dizziness or any other kind of the more extreme CCI symptoms. It was just not great, acuity, and I had the headaches. So I had that. I'll go back. The MRI portion that led me to one appointment with a neurosurgeon I talked about in another episode. So I did see a neurosurgeon to review the MRI, and he kind of laughed me out of the office. I talked about that in the other video. And he sent me to physical therapy, and that was my first time going to like formal physical therapy, and they gave me a whole bunch of very traditional exercises that you do for spine. None of which are really, that now I've learned, like none of which were really particularly recommended for CCI, but they didn't know and I didn't know. So I did a lot of these very generalized physical therapy exercises. And in addition, they recommended this dry needling, which is done by an acupuncturist. And in California, they're not even allowed to call it dry needling because the legal framework of it or something is not quite the same here. But yeah, so in acupuncture, I think in some states, physical therapists can actually do this needling. But basically what they do is they use a very, very small needle that they're not injecting anything. They're putting the needle into the muscle, and by causing that, I don't actually know how it works, but like basically put a needle in the muscle relaxes. Don't ask me how it works. It just does. So in California, you cannot get it done by a physical therapist. In other states, I believe you can. But in here, I had to go to an acupuncturist to do it. But even the acupuncturist couldn't say that it was dry needling. They were just saying, well, I'm doing acupuncture on you, but I'm doing it in your muscles. So the physical therapist recommended an acupuncture person that would do dry needling on me. And so that was really, I'll describe it a little bit because, other people, it might be helpful if it's recommended to you. But yeah, it's another way of getting your muscles to turn off. It's very inexpensive and safe. I think as long as you're going to somebody that, knows what they're doing, obviously. So yeah, I went to this acupuncturist, and he was actually connected with the same group of physical therapy clinics. He was just at a different location. And he did some kind of traditional acupuncture where it's all about the meridians and it's kind of this, very, very hard to explain stuff that really makes no sense to me, but, does help people, I guess. But yeah, so he did some traditional acupuncture, but he also did dry needling, which was primarily why I was going. And he basically focused on that for me and tried to get some of the bigger structural muscles holding the neck, from the back, and he would get a needle in there and try to get it to relax. And yeah, I mean, the first, like so many things I've done, I mean, the first one was actually really good. Like I felt like I got all this relief. Everything that had just been like holding on for dear life all of a sudden is just like relaxed. I didn't have any flare up in CCI symptoms, which is good, because I think if my case were different, that might have been a huge mistake to let the muscles relax. I tend to get more nerve issues, and having muscles relax seems to help with, letting the nerves also settle down. So in my case, yeah, it was beneficial, and so I kept going. But I never really got that same benefit out of it as I did the first time. And then he offered me something, I think after the third time I went, which, just to forewarn everyone, this is something you might see out there, is he said, well, would you consider letting me do stim on the needles? And I was like, okay, well, what the heck is that? Like, he's like, well, I'll take, a TENS unit, which is a electrical, micro electrical kind of thing that's used by physical therapists and whatnot, like help the muscles and nerves kind of chill out, because you just feed them a signal and it sort of blocks any pain or whatever. So he's like, yeah, I have these little, alligator clip things, and I put the needle in, and then I hook up the I hook up the electrical stimulation to the needles. So it's going right, the needles are metal, so it goes right down the metal, right into the muscle, and you get this stim that's like right through the skin and to the muscle. So I was a little bit like, I don't know, like, is it is it okay? Is it gonna hurt? Is it, I was quite concerned about it, because I'd never considered anything like that being done to me, not while I'm awake anyway. So, but yeah, it was, I agreed to it. I trusted the guy, and I'm like, okay, I should try this, because I'll try anything, right? So yeah, he hooked up put the needles in, and then he hooked up the electrodes, and then, starts it off like really low, so you can like barely feel it. And then he brought it up, and it was kind of like, oh, okay. Like, I get it. I mean, it doesn't hurt. But it didn't really add much for me. It didn't make it more, it didn't give me any more benefit. So, but it was just crazy. Like, I've told other people that I've had this kind of needle procedure, and they're all just really queamish about, like, how could you ever let someone do that? But it wasn't that bad. So, okay, so that's my acupuncture story, and specifically what is generally called dry needling, although depending on where you live, it might not be legally called that. But that was what I did with acupuncture. So another thing that I tried while I was kind of trying to figure things out, and I was just trying to find local resources and, help, is I went to a regular doctor. I made an appointment, with a family doctor or whatever at a regular clinic, and I just went in and like, okay, can you help me? Because the last time I had done this, I just sort of gotten told to take Tylenol, and it wasn't, I wasn't impressed. So, but I was in San Diego at this point, so it was a new city, and I was just looking for options, and so I got this new insurance and all that. So I just went in and saw a doctor, and they were like, oh, we'll do all your blood work. And I'm like, okay, fine, just do the blood work. And I told them about my CCI symptoms, although I didn't know that it was CCI. And of course, they obviously didn't know, because they probably didn't even know what CCI was. But it was good. The doctor was quite concerned about it. She said, that's a lot to deal with. Like, you really should see a neurologist maybe. And I was like, the first thing I remember, this is kind of funny, but like, when I heard, I didn't know what a neurologist was or what they did. And I just thought, like, I'm not neurotic, and like, maybe I am, but I asked the doctor, I'm like, okay, can you explain, like, what exactly does a neurologist do? Because I don't know. And she just laughed, and she said, oh, like, neurologists help people with headaches. And I was like, oh, okay, well, that sounds good. Like, I'll go to see a neurologist. Because I literally had never heard of a neurologist before that. So I got this referral to a neurologist, and I'm trying to think if there's anything. No, I think that's the only thing I really got out of that doctor's visit, was that, and the labs, which of course, like, said I was totally fine. So I had the referral to the neurologist, and was excited because, like, okay, well, this is a specialist that helps people with headaches. It's not necessarily treatment for a neck problem, but I do have headaches, and it would make sense to see somebody who specializes in headaches. So I went to the neurologist. So this next little segment, I'll just give you the hopefully abbreviated version of the neurology care that I had, which extended over a couple of years. So it was actually quite a bit of time I spent seeing a neurologist. So I started off there and explained all my symptoms. I talked about the neck pain. I talked about the headache. I provided my MRI. At that point I knew quite a bit about the spine and all, and I knew that I had, like, the headaches were probably related to some issues in the upper neck, and but, like, I'm just looking at the neurologist while I'm telling her all, and she's kind of like, yeah, why are you telling me all this? Like, I don't need to hear any of this. Like, it's anyone with CCI is going to completely understand what I'm talking about. Like, doctors, like, they are so siloed in whatever it is they specialize in, and they really don't listen to your history, like, for the most part. I mean, there are doctors out there that are really interested in being detectives and trying to actually help people get diagnosed properly. But anyways, this neurologist was, one of the best in the city. I mean, I didn't go with the one that was referred by this, like, family doctor. I like went and found my own, and because I had a PPO insurance plan, so I found, like, one of the best neurologists in the city. Anyway, so she was not interested in hearing my theories about my neck pain and all of that, and that, that I also had these joint issues, and that there was this nerve stuff going on. And she's like, no, don't waste my time. Like, she's like, you have migraines, and the migraines are caused by your occipital neuralgia. And it's kind of actually where I learned about the term occipital neuralgia. Like, she basically said that, what I was describing, is at least what she could understand from everything I told her, was that I had occipital neuralgia, which is the irritation of the C2 nerve. So it is a neck-related condition, because the C2 nerve is coming out of the neck, and it gets fed up, and it causes this sort of tingling nerve pain in the back of your head, usually a dull pain. So she's like, you, sir, have occipital neuralgia, and it is causing migraines, and that's what's going on. And so I treat migraines, and I can also, she also had some things to treat occipital neuralgia, but she was mostly interested in treating migraines, because that's what she does. She's a neurologist. She treats migraines. So I had migraines, but the problem was I didn't have migraines. But not knowing any better, I just kind of played along and was like, okay, well, she knows a few things that I don't, and I do have occipital neuralgia. That part I believed. I did not have migraines, but I did have occipital neuralgia. So, okay, so basically the plan with the neurologist was that I would go back to physical therapy, but it would be with her therapist. So I was like, okay, fine. fine, like I'll do more physical. It was a brand new calendar year, so I had, 20 more sessions of physical therapy that I could use. And then she would do these occipital nerve blocks. But these are not the kind of injections that, I had off in Denver with all these expensive, like, regenerative medicine. I mean, these were literally just like her eyeballing where my occipital nerve was and just ever so gently going just right under the skin and just sort of squirting it up and fanning the needle out a bit so that the lidocaine or whatever was used, I think it was a different, it was not a steroid, but it was some kind of temporary anesthetic. So she did this occipital nerve block, which was very superficial, meaning very close to the skin, and it was also blind. There was no imaging. There was no, at most she was just palpating it with her fingers and then putting the needle up and done. So I had these occipital nerve blocks, which was to try to address occipital neuralgia. And then the migraine treatment was all medication based. So I was treated like a migraine patient. I was given topiramate for a couple months, which is nasty stuff. but like, okay, I was taking it. What I realized is that, well, actually, okay, I can add another layer to this story, but so I was getting a little bit, I guess, frustrated with the way this treatment was going with the neurologist. So I think I went back to the family doctor at the general practice doctor that had referred me in the first place, and just to sort of like, it's a cheap appointment, so I was like, okay, I'll go back there and kind of give her an update and whatever. And so I went in and I said, yeah, I've seen the neurologist and we're doing this and this and this. And I just said, I really don't know if I should be taking all these migraine medications. I mean, I feel like a zombie during the day. And I don't know what to do. I obviously don't want to offend the neurologist. And so, it's another, I got over all this, like offending doctors didn't become a problem for me. I got quite good at that later on, but at this point I was still afraid to kind of be too, to push back too much. So I went and saw this original doctor, just kind of telling her like I wasn't so sure about this migraine business. And she said to me that maybe that given everything I was going through, that there was a lot of muscle stuff involved in my condition, that I could get Botox. And she was explaining to me how like Botox helps a lot of people with migraines, and it is essentially trying to neutralize small muscles that cause these headaches. Botox is it's a toxin for starters, but it basically disrupts like muscle function, and can it paralyzes muscles essentially. And so it's used in extremely small amounts, and it's used to treat a whole host of different things medically, migraine being one of the probably more popular uses of it in the States. So so she got me on this train of like, maybe I should get Botox. Maybe Botox would let all these muscles, because at that point I think muscle pain was really the dominant issue that I had, and it was also leading to a lot of the joint irritation because the muscles are tight. You're always the urge to kind of crack your joints in the neck, and it's because the muscles are so tight. So okay, so that was an aside. So I had this sort of renewed interest in continuing with the neurologist because the neurologist was in a position to get me approved for Botox, which is actually quite hard to get approved for in the US. So I took my topiramate like a trooper, and I kept my headache journal because that was a requirement to work with a neurologist. Previously, I had been asked to do like different journals for pain and headaches, and I was like, yeah, whatever, I'm not doing that. But I had to have one, and she actually would look at it as well. So I actually had to be good about journaling my pain levels, and I took the Pyramate, and then I took another one. It was injectable, so there's a new kind of migraine treatment where you inject once a month with a syringe. Like, you have to do the injection yourself, which was a little like, whoa, really? Do I have to? But it wasn't like, once I learned how to do it, it wasn't that bad. So I did this injectable migraine treatment that, of course, none of these things worked because I didn't have migraines. Like, it was such a ridiculous thing to do, but whatever. I didn't know any. I was led down the garden path, and it was like, okay, I'll take all these crazy drugs that really are not treating me for the right thing, but whatever. It sounds idiotic now, but it seemed like a reasonable approach at the time. So I had these 2 migraine treatments, which in her view were enough to get my insurance to authorize the Botox. And the reason Botox is so hard to get is that, it's a very extreme drug. Like, it's dangerous, right? And so you can only get it from a neurologist or somebody like highly specialized. And then it's also extremely expensive, probably because it's so dangerous as well. So it's very expensive. It's only made by one company in the world, in Ireland, called Allergan. So I'd had gone through these 2 different migraine medication treatments, and I was like ready to get my Botox, because I thought, well, maybe this will be the thing that will help me, and the original doctor was kind of pointing me this way, and so it was like a lot of focus was on getting Botox. And then I waited for like a month or something, and I at that point I had like run out of physical therapy sessions, and so I was kind of like just idling. And the neurologist's office phoned, and they said, oh, like, we need you to come in again. And I'm like, well, am I getting the Botox? And it's like, no, the doctor will talk to you when you come in. So I went in, and I'm thinking like, oh, what now? Like, what are they going to tell me now? So I went in, she said, so I thought that having 2 different, treatments was enough, but your insurance is actually requiring us to, for you to try another migraine medication. So I'm not sure if one of the meds that I was on, perhaps the injectable one, was like disqualified from being considered, or if they just all along required 3 different medications before they would approve Botox. But whatever, I had to take a friggin' 3rd medication. So she put me on amitriptyline, which is it's an antidepressant basically, but it treats migraines, I guess. And so I'm like, okay, well, at this point, okay, fine, I'll take an antidepressant. I mean, like, what do I have to lose, right? I mean, I may feel better, right? So I took the amitriptyline for like a month, and it was good because I only had to do it for a month. So I took it for a month, didn't do anything, and then I'm finally sort of ready for my Botox, and I went through definitely there were still some insurance hurdles which were annoying, and at that point I also got better at fighting back with the insurance company, but I was still early in learning how to do all that. But yeah, so the insurance eventually relented, and they authorized the Botox, and I went in and had the Botox injections. So I can talk a little bit about that, and then I think then I can close this chapter off, because ultimately it didn't work. But so a Botox injection, you basically your insurance will Botox is ordered through a pharmacy because it's a drug. It's treated as a drug, but obviously it's very there's very high security around it. So you don't just go to CVS and pick up your Botox. Like, that's not how it works at all. So your insurance will approve it through the neurologist, and then your insurance has a pharmacy. Generally, either it's internal to the insurance company, or it's what they call a specialty pharmacy that's part of the network of your insurance. So that pharmacy then procures said Botox in however many units you're going to get. And then the medication is, FedExed to your doctor's office. And sort of all that, the timing of all that has to line up with, when you have your appointment to get it injected. And I think it stays in the fridge or something like that. But the timing it requires some careful handling. Like you can't be going off on a trip or something while your Botox is being delivered. So you have to be in town and ready and all of that. So, but the neurologist's office, they know what they're doing. So they tell you what to expect, and their timelines are generally accurate as far as when you are likely to need to go in. So I went in, and it's already in the medication is already. As far as I could tell, I don't know. I don't know if they fill the little needles ahead of time, but I'm assuming that the pharmacy or maybe even the manufacturer delivers this stuff already in the little needles. So your neurologist gets this tray of tiny. They're like about this long, and they have a little handle on them or something, a little thing that they can hold, but they're really small, and there's this whole tray of them. And each one is for one injection site. And I believe the Botox protocol is 16 injections. So it's a lot of injections. If you're not good with needles, it's a tough one. I personally do have some issues with needles. So the funny story, well, funny for me, but maybe not for the doctor, was the first Botox treatment I had. I had about 7 or 8 injections, and it was going okay. I'm just sort of trying to breathe and trying to relax, and I'm getting these Botox, and some of them are in your forehead and your nose, and they have a migraine protocol of where they put the stuff. It's weird. Some in the shoulders, but yeah. So I made it halfway through, and then I started to feel a little bit sick, and I recognize the feeling because I just know that with needles, if there's either if the needle is in for a long time or if it's multiple pokes, I can get a bit of a reaction, and it's literally just a kind of a fight or flight kind of reaction, and I know I can feel it coming on because I've had it many times before. So I just told the neurologist, I just said, can we take a break? I'm feeling a little bit nauseous or whatever. And she's like, oh, sure, I'll go get you water. And so she left the room, and I was there alone. And then the next thing I remember, I'm looking up, and there's all these people over me, and they're like, oh my God. So I guess I had actually passed out. And they were just absolutely terrified because they just injected, toxic substances into me, and I'm laying on the floor. Anyways, I explained. I'm like, oh no, I'm sorry. This is not new to me. This thing with needles, and it's this has happened to me before. I have passed out before, even just getting blood drawn. So yeah. When I had the second Botox treatment, which was 6 months later or something, because she wanted to do a second one just to be sure. The first one didn't work, and she's like, well, let's do a second one. Your insurance is already paying for it, so I got a second one, and they definitely put me in a more protected position when they were injecting me. They didn't just allow me to sit in a normal chair because they don't want to have me. They don't want to come in and find me on the floor. So. And I did not pass out after the second one. I did just fine. So anyway, so that's my Botox story. It's, it helps people with migraines. I don't think that it's really a useful CCI treatment. Maybe put in the comments if it's helped you, and you believe it's been helping CCI, but in my case, it didn't help me. And I was really only getting it because they believed that I had migraines, and even at the time, I didn't think that I had migraines. I was looking for treatment that might help, and it seemed like that was where I was being led, and it was local, and it was, it was through it's a mainstream treatment. I mean, it wasn't crazy like some of the regenerative medicine that I did, which is controversial. Like a lot of people hear, like, I did all the stem cell stuff, and they're kind of like, really? Like, aren't you smart enough not to know, like, waste all your money doing that? It's like, well, So, yeah, but the Botox, whatever, it is what it is. And okay, so a couple more things then, and then I see how the time is. Yeah, I got like 50 minutes in already. So yeah, so I'll just like a few other things that I can share about that early phase of treatment. So I also did, I saw a rheumatologist, and rheumatologists treat issues of the joints, most commonly rheumatoid arthritis, which is a kind of it's an autoimmune issue, but it's kind of like your own body is attacking its connective tissue. And so I wanted to rule out any kind of inflammatory condition such as rheumatoid arthritis, or ankylosing spondylitis is another one. So I did see a rheumatologist and had him also look at my imaging, and he was sort of like, there's nothing here, there's like, you don't have RA, you don't have ankylosing spondylitis, like, go away. I made him look at my x-rays and stuff, and I mean, it was nice enough that he sort of popped them open or brought them up on his computer, and he was kind of looking at it. He's like, yeah, everything looks fine, like, you got a little, like, the joints look a little bit, like the curvature, I guess, of my facet joints, like, look like they've been worn down a little bit. But he's like, like, whatever. So it wasn't that helpful for me, but I saw that. So, and then another one that I tried was, there was a pain management doctor that had been recommended, who was in San Diego, which is where I was living. And he does treatment called radiofrequency ablation, which is where they will go in and essentially melt the nerve. So they use a needle that has a microwave tip. So it's like the same as like your microwave oven in your kitchen. They're basically using a microwave to heat up the nerve until it melts. Or till it's, no longer connected to the spine, which sounds awful, but you don't really feel anything. But it's temporary. I mean, the nerves grow back. That's the thing about the body. Like, the body regenerates. So I had heard about this guy, so I went and saw him, and I had him do some diagnostic blocks. But again, at this point in the story, like, I didn't know, that I really didn't know enough about all the levels of the spine and what did what, and like, this was quite early on. So he injected 3 to 5 in my neck, and I felt the diagnostic blocks, like, it was like, yeah, okay, like, I felt a little bit better. And so I'd had a radiofrequency ablation of C3 to C5. Which is quite a bit of treatment. Like, it was a lot, and it was a lot of nerves treated. But yeah, it didn't help me tremendously. Like, it was a incremental improvement, and then it wore off. I mean, my symptoms came back with a vengeance. So that's something else to be aware of with things like radiofrequency ablation is you burn it, and you melt the nerve, whatever, burn the nerve. Like, you get some benefit because, like, it's electrically, it's just severed, but it grows back stronger. And so if you have pain, you may help yourself temporarily, but then it regenerates, and it regenerates in a more robust way, because it's like, well, we don't want to let this happen ever again, or that's what your body is thinking. So, so you end up amplifying, your issue in a way. Plus, I mean, he was treating the wrong levels. And by the time I figured things out and I went to see him again, I was like, yeah, it didn't work so well. And like, can you treat, the upper neck? Because that's like, I think a lot of my symptoms are, the headache and all that. And he's like, oh no, nobody treats the upper neck. Like you can't inject above C2. And like, he was just giving me this. The guy I didn't care for him too much. I mean, he was recommended, but he had a terrible bedside manner. And he basically just blew me off and said that, no doctor that's, of the right mind would inject above C2. So I don't know. I believed him at the time. So I did try radiofrequency ablation. And let me think if there's anything else that I'm missing, but like I'm just sort of jumping all over the place here. This video is probably not the best one, but whatever. I mean, I'm trying to do these. I'm trying to just get the story out, and maybe there's little morsels of stuff that will be helpful for people. I guess the other one is, I'll close with the last one because I'm now at like almost an hour. So the last thing that I stumbled across was NUCCA. And so in my video 3, which was the one prior to this, I talked about doing Atlas orthogonal chiropractic, and I talked about doing chiropractic biophysics. Both of those are areas of specialties of chiropractic medicine that are aimed at people with these kinds of upper cervical issues. Again, really, really specialized, a really kind of narrow focus treatment of the spine. The other one in that sort of group of specialized chiropractic techniques is called NUCCA, NUCCA, and it stands for the National Upper Cervical Chiropractic Association, I think. So yeah, if you look up NUCCA, you'll probably find NUCCA chiropractors throughout the US and Canada and maybe even other countries. There are more NUCCA chiropractors than AO chiropractors. NUCCA is more common, and it's a similar style to AO, and AO is basically trying to adjust the C1 vertebrae with a special instrument that has a metal stylus and a very calibrated kind of dial where they can be very precise about what they're adjusting and how much and what direction. So NUCCA is the same idea in that they want to primarily adjust the atlas, and because of that, it's a very gentle adjustment. It's not the crack adjustment, the high velocity adjustment. It's a gentle adjustment. But the NUCCA people use their fingers and their arms to thrust, and the AO people use that machine. So one is using a machine that's potentially more accurate and able to repeat the same adjustments like with greater precision. The NUCCA people, it relies on the skill of the chiropractor. I mean, because it's their body position, it's their fingers and all of that. So, but it's the same idea. So I did this NUCCA treatment in San Diego, and I did really like the doctor. I mean, I thought he was very personal. It was a little bit salesy, as so much of this stuff is. So his clinic, and I think a lot of NUCCA clinics do it with a package. So you go in and you might do a kind of an intake assessment that's free, or they say that it's free. I mean, you pay for it later, basically, but you get the sort of free assessment. They try to review whatever imaging you have, and they try and sell you on a treatment plan. And instead of just sort of saying, well, you should come twice a week and it costs, X dollars per visit. And they say, okay, like you need a plan to like twice a week for this many months. And then, some x-rays here and a follow-up visit here. And like, okay, so we'll do all of this for, $3,500, right? And so, yeah, so I got sold on one of these treatment plans where I spent all this money. And I started going, and it's kind of the same as the other chiropractic care that I'd done. some benefits in the very, very beginning, but really nothing after that. And the doctor was shocked. I mean, he really, I could just see, like, after I'd gone for about a month or so, he had a questionnaire that I filled out in the waiting room, and then I went in and I was like, okay, ready for my adjustment. And he's like reading my question. He's like, "You're not any better at all?" And I was like, "No, not any better at all, zero." And he's like, "Oh, well, that's not good, So yeah, I let it go on a little longer. After that point, probably I should have just. That was a message to me that, like, this isn't working, and I need to have a difficult discussion with him about how much money am I going to get back because this isn't working. But I went along with it a little bit longer, and then what happened was I was moving, actually. So I was like, well, I'm moving, so I need a refund or something. And on top of that, like, this isn't really helping me. And so we did work out a kind of a prorated refund, although it was more in his favor than mine. Whatever. I mean, it's you have something like this, you have to accept that there's a lot of people with their hands out that are, like their business is treating people like us, along with just mainstream people as well. But I don't know. I have I'm very cynical about the whole thing now. But yeah, I did NUCCA. I did it for a couple months, even though it wasn't helping me, and I spent a couple grand on NUCCA. And that's my. I don't really have anything else to say about it. I avoid those care plans where you're paying upfront because it just makes it. I see why they do it, because people realize, like, they change their mind or whatever, and then they stop going, and then the doctor doesn't, they lose the business, right? So these care plans, they get you kind of stuck there, and they make it difficult to get out of them. But, yeah, you have to speak up. And I learned to. I got better at it later on. I got better at firing my doctors. So look out now, right? So yeah, I think I'll leave it at that. This was this is kind of all over the place, this episode, but I did want to talk a little bit about the other things I did besides PICL and prolotherapy, which are kind of regenerative medicine treatments. And so the next video, the plan is to actually talk about what I did after PICL2 and talk a little bit about my experience in the mainstream neurosurgery world, because that's kind of what I did after that. So I saw some neurosurgeons and had varying experience with it, but ultimately ended up with the proper diagnosis. So that was really the only good outcome of all of the time spent trying to see neurosurgeons. But yeah, I'll do that in the next episode. So this is now the longest one I've done. Sorry, but thanks for listening. And please like the video so that it helps other people find it. It will improve the algorithm, for YouTube and all that. And if you have comments, I would appreciate any comments you have. And I promise the next one will be a little bit more organized, because I can thread together the whole neurosurgery story a little bit better than this video. But I did want to cover this kind of hodgepodge of various different types of things that I've done to address my CCI. So we'll talk to you next time. Thanks for listening. Bye.